Hi, everybody. Dr. Kogan, Medical Director at GW Center for Integrative Medicine. Today, I want to discuss a recent study that came out in JAMA Oncology a couple of months ago. And this study looked at use of opioids in patients with cancer in the states where cannabis was legalized and impact of that legalization and use of cannabis on use of opioids. So first, I'm going to share the screen and then put the study up so you can see it. So the study titled Medical Marijuana Legalization and Opioid and Pain-Related Outcomes Among Patients Newly Diagnosed with Cancer Receiving Anti-Cancer Treatment. So these were patients with relatively advanced forms of diseases. They were not kind of a mild early cases. They're particularly just three cancers that they looked at. They looked at colon cancer, colorectal cancer, which is colon cancer, breast cancer, and lung cancer. But the total number of patients was quite high. We're looking at over 50,000 patients. As you can see, the total numbers here. I'll show you a graph over here. So there were almost 40,000 women, mostly with breast cancer, 12,000, almost 13,000 colorectal cancer, and 7,000 lung cancer. You can see the breakdown. Patients, all of these patients had a lot of different pain syndromes. So the requirement obviously was that they had some kind of pain. And you can see that the pain was broken down by a variety of different syndromes, back pain, neck pain, etc. Minority of these patients used tobacco. That actually does come somewhat important because you want to make sure that there are no interactions between cannabis and tobacco. You can also see that pretty much more than 50% of these patients had chemotherapy, and then somewhere closer to that, but less were radiation, and only some patients got cancer resection surgery. So patients, this is the kind of the amounts of opioids that were used. Different opioids were used. Some patients used opioids for a long time. Some patients use it for brief periods of time. And, as you would expect from prior studies, anytime that the medical cannabis is legalized, the amount of opioids used in a particular state would go down. Now, what's new about this study is that previously this was an overall review, so of all of the opioid use. This is specific to cancer. There was a belief in the past that patients with cancer, the cannabis is not very beneficial for chronic pain. I disagreed with that. I've recommended to most of my cancer patients cannabis for pain because I actually find it to be often more effective than opioids, or at least equivocally effective, and often you can easily combine it. And that's basically this study reinforces what I've been doing clinically in the past, and also reinforces the fact that a lot of patients who begin to use cannabis need to use less opioids. So I'm going to show you a couple of things here. So this is the patients who have estimated rate of 1 or more opioids days during the 6 months after the new cancer diagnosis, conditional on exposure to cannabis. And so you can see that in both cases, especially right here, you've seen decreased in opioids, and it seemingly was regardless of what cancer you're looking. This is breast, this is colorectal, and then this is lung. So I'm going to actually show you a graph that's probably better graph. So what do we have here? Well, we have cannabis legalization without dispensary and with dispensary. What's the difference? The difference is if you don't have dispensary, only patients who grow cannabis at home themselves can use it, basically, unless, of course, they buying it under the table, but usually that analysis is excluded from studies like this. So you can see that, as you would expect, and also consistent with prior studies, the states with dispensation show significantly larger drop to a lower percent use of opioids. So this is no dispensation and no medical cannabis. Then this one is the without dispensaries, and you can see this is with dispensaries. And again, it was true across every cancer. So breast cancer, colorectal cancer, actually colorectal cancer saw a larger drop. And then interestingly, in lung cancer, it didn't kind of matter whether you had dispensation or not. And so the other set of graphs that I was going to show you is a little higher up. This one, I think the importance here is the sort of what is the actual overall grade of effect. That's actually is important. The grade of effect is basically if I give a cannabis to 100 patients, what percent of patients would in this situation I would expect to stop using all the opioids. And just to kind of not bother you with a massive amount of details, because they've analyzed it to the T here, they looked at every specific situation. The composite, the total was that the decrease was, as you can see from here, basically it was quite significant. You're looking at medical marijuana legalization was associated with a reduction in the rate of one or more opioid days from 90 to 84%. So that's 6% absolute or absolute reduction among patients with breast cancer. And then from 89 to 84. So again, it's roughly 5% for colorectal, and also about 5% for lung cancer. Now that's absolute. So if you look at the actual relative, that constitutes somewhere near 20%. That is not a trivial decrease. It means that also those patients who have stopped taking opioids or decreased use probably going to have significantly less side effects of opioids. Now, this study didn't address that directly because that's not the goal of this, but you would definitely expect that given everything we know about use of opioids in cancer patients or in actually any population. So overall, their conclusion was that medical marijuana legalization was associated with a reduction in rate of one or more pain-related hospital events also, and that was a pretty dramatic decrease. So that's a 6% total drop in hospital admissions. Now, if you think about this, that the average hospital admission in the States for cancer patients probably at the minimum $20,000 to $30,000 a year. I mean, you're looking at the pretty mass reduction in overall societal cost, since the patients who are obtaining cannabis paying for it out of pocket. That means that the insurances had to pay less for all of this admissions, as well as just less opioid use. So that also has to be taken into consideration. One should argue, well, in this case, shouldn't the cannabis be covered by insurance? Of course, the answer should be absolutely, as we have a rapid increase in total amount of data supporting the use of cannabis, not just for pain generally, but in this particular scenario, pain and cancer. So I think overall, it just adds to our knowledge in terms of the efficacy of cannabis for a variety of chronic pain, including cancer-related pain. I have not covered the older study that was published probably at this point several years ago. This was the study of use of pharmacological drug that's produced in Europe called Sativex, which is an extract of THC and CBD 1:1. That was applied in metastatic disease and cancer in a randomized controlled trial, and it failed to control the pain. And I do think it's important. I'm not going to review that study in detail in a future videos, but I want to bring up the point here why I think it failed. Well, it failed because it's a purified THC and CBD, and we know from our experience that by the far, most patients prefer to use medical cannabis. They find it's more effective. The entourage effect between cannabinoids and terpenes and flavonoids seem to add value. We actually nowadays know how to utilize that. So I'll just give you one example, which is a common example. So adding beta-carotene, for example, as a terpene, or including strains that have the higher proportion of that terpene, seems to control pain better. And there are others. So, as the field grows and moves forward, again, we would expect that patients would continue to prefer to use medical cannabis rather than synthetic cannabinoids. I don't think that will change. And I hope that the next studies will start including more control trials, not just observational cohorts, which this was. So hope you find this helpful. Stay tuned for more videos. As usual, I'll put the link to the study in the chat. I mean, in description. And also, if anybody have questions, please by all means don't hesitate. Put the comments on the YouTube and subscribe to the channel. Have a wonderful day. Bye.